This video shows you how to do pre-procedure CT planning using the Redo TAV app. For cases where an index TAV is SAPIEN 3 and second TAV is SAPIEN 3 or MyVal. When you click Redo TAV CT planning on the home screen, first you will get the overview of all steps you need to do. The CT acquisition protocol can be the same with routine pre-TAV assessment. It's recommended to obtain ECG-gated multi-basic functional CT that covers the entire cardiac cycle with ideally 20 phases, a minimum of 10 phases. The mid-diastolic phase generally has fewer artifacts, allowing for better assessment of the process reflex and commission alignment in most patients. The end-systolic or end-diastolic phases could be used as alternatives. The first step is index TAV and measurement. If a pre-index TAV CT data is available, select native valve morphology and the severity of calcification, and identify your patient index TAV type and size. And then you will get the fundamental information of the valve. The leaflet of SAPIEN 3 will extend to the top of the commission TAV when it's pinned out by a second TAV. So the top of the commission TAV is the reference level for index SAPIEN 3. On the next page, select the index TAV failure mechanism and assess commission alignment. Open your patient's CT dataset on a CT software. We can use any CT software. We just need 3D MPR multiplanar reconstruction module. After determining the appropriate cardiac phase, align the MPR to be orthogonal to the valve. And assess commission alignment, which refers to the relations between the native aortic valve commission and THV commission TAV. The commission offset is directly measured using an angle tool with the limbs aligned with THV commission and the native commission of the RCC and LCC. This case has almost aligned commission, so select aligned. And perform the measurement of area and perimeter. These measurements will be used for second TAV sizing later. We can also understand how much the index TAV is underexpanded at this point. For SAPIEN 3, 3 levels require assessment: outflow, base, and inflow level. Here is the outflow level, making sure the MPR is precisely orthogonal to the valve, and measure the area by tracing the center of the stent frame because of less blooming artifact. And you will get area and perimeter. Next, move to the base level, narrowest level, and again measure the area by tracing the center of the stent frame. Adjust the tracing if needed. And lastly, move to the inflow level. Again, measure the area. After or during the measurement, please fill in the areas and the perimeter in the app. Step 2 is identify your patient coronary risk limb, which is defined as the lowest level of coronaries in relation to the SAPIEN 3 reference level, where is the top of the commission TAV. On the CT, now we are in the inflow level, so scroll up the plane. Now we are reaching to the bottom of LCA. So align the MPR to the LCA to identify the relationship between the bottom of LCA and the top of the commission tab. So now the bottom of LCA is below the top of the S3 commission tab. Next is RCA. So scroll up again, and now we reach to the bottom of RCA. Adjust the MPR line and identify the relative relationship with the top of the commission tab. So the bottom of RCA is just below the top of the commission tab. In the up, select the bottom of RCA and LCA ostium, and the app automatically identifies the coronary risk plane. At the step 3, once you select the second tab, you will get an idea about ideal or acceptable level of neo-skirt plane, NSP, which is defined as the top of the neo-skirt. For MyVal in SAPIEN 3, it is a single level at the top of the commission tab. For SAPIEN 3 in SAPIEN 3, it is the same, the top of the commission tab. For these combinations, we have only one selection for the neo-skirt plane. And this level, top of the commission tab, is above the coronary risk plane, the lowest level of coronaries of this case. Therefore, the coronaries are at risk and needed further assessment. Since the second tab size may affect the coronary risk, we need to determine a second tab size next. Step 5 is in vivo CT sizing. We already measured the areas and perimeters at the 3 levels at step 1. On the up, the 3 levels will be automatically selected, so please make sure the numbers are correct, and if you would like to, check the button of Include Perimeter and click the Calculate button. Then you will get the calculated average area, perimeter, area derived diameter, perimeter derived diameter. The app cannot suggest sizing at this point due to the FDA regulation, so you will need to choose the second tab size based on your CT measurement. Here are some guide how to choose size. And here you can get IFU table too. For this case, I will choose size 26 SAPIEN 3. With the size you choose, move to the step 6, coronary risk assessment by valve to aorta measurement. Since a balloon expandable second tab could expand an index tab, reducing BTA distance, drawing a virtual circle of second tab size chosen would be recommended to estimate BTA distance. And identify the narrowest BTA distance from virtual circle or index tab centrum, whichever is outer, in the zone from the neo-skirt plane to the coronaries. When the neo-skirt plane is above the ST junction, please don't forget to assess VT-SUJ. In the app, the relationship between the neo-skirt plane and each coronary is automatically identified. When the neo-skirt plane is above RCA or LCA, the relation between the neo-skirt plane and SUJ needs to be assessed. I would recommend to assess RCA and LCA separately. So let's start with RCA. On the CT, bring the plane at the neo-skirt plane, which is the top of the commission, and assess the relationship with the ST junction. So in this case, the neoscot plane is below the SG junction, so no need to assess VT-SGJ, but still need VT-LOS and VTC with virtual circle of the size you choose. And in this case, the virtual circle just within the index TAV stent frame, so measure the VTC distance from the index TAV stent frame to the center of the coronary, and enter the value in the app. And move to LCA assessment. On the CT, let's focus on the LCA. First, assess the relationship with the SG junction. Now, due to the canting for LCA side, the neoscot plane is above the SG junction. So we need to assess VT-SGJ with virtual circle. So the virtual circle is just on the index stent frame. So measure the distance from stent frame to the RCA. And now scroll down the plane and measure the VT aortic to VT AOS, valve 2 aortic sinus. So again, almost the same with the virtual circle and the index stent frame. And get the value and enter the app and scroll down to the coronary level. Again, draw the virtual circle of the size you choose for second TAV and measure the VTC from the index TAV stent frame or virtual circle, whichever outer, and enter the value in the app. The app automatically identifies the lowest VTA from VT-SGJ, VT-AOS, VTC you entered. And then you will get summary report of 3 pages with animation representing the relative relationship between the neoscot plane and both coronaries. You can take a screenshot and also can import this document report to the CT software summary report, like 3 mentioned. And if available, pre-index TAV CT data can be gathered at step 8. Next, let's see when the neoscot plane is below coronary risk plane. Step 1 is same. So step 2, let's see the example of the case. The neoscot plane is below the coronary risk plane. So here, first identify the top of the neoscot plane, which is the top of the commissural TAV. And now you can see the bottom of RCA, which is above the top of the commissural TAV. And now let's see the bottom of LCA. Here is the bottom of LCA. This level is also above the top of the commissural TAV, just at the stent frame. So in the app, you select the above at top of the stent frame for both RCA and LCA. And you choose second TAV. Same shown as before. When you select the SAPIEN 3, you will get an idea where is the ideal level of neoscot plane. And Choose the neo-scat plane and assess the relationship between neo-scat plane and the coronary risk plane. So in this case, the neo-scat plane will be below the coronary risk plane, so risk to coronary is considered as low. Step 5 is second TAV sighting. This is the same with I showed before. So in the app, automatically the 3 level will be automatically selected, and you will get the average area perimeter. And based on your CT assessment and also IFU table, you will choose the second TAV size. And step 6 is coronary risk assessment. As I mentioned, in this case, the neo-scat plane will be below the coronary risk plane, so no need further VTA measurement. And you will get the summary report. This is all steps we need to do for pre-procedure CT planning for SAPIEN-in-TAV combination. I hope this video guides you to planning. Thank you.